Okay, hello. My name is Heli Siltala. I'm a psychologist and doctoral student at the University of Jyvaskylan, Finland. My topic today is associated with my doctoral dissertation, which I'm finishing at the moment, and it's about recognition of domestic violence in healthcare settings. In this presentation, I'm going to talk about two main points. First, I'm going to tell you why domestic violence should be regarded as a public health issue. My key points are that the domestic violence is so common and has so many associated health problems that it should be regarded as a general health risk, just like smoking or obesity. After that, I'm going to talk in more detail about recognition of domestic violence in healthcare settings. I'm going to discuss how recognition of victims could help them and what needs to be taken into account when facilitating more efficient recognition policies. Okay, so let's get started. As we know, domestic violence and especially violence experienced by women is very common both in Europe and elsewhere in the world. Finland also has one of the highest prevalence rates in the EU. We also know that the healthcare costs caused by domestic violence are counted in billions. Although exact rates are very difficult to calculate, the healthcare costs are not restricted to treatment of injuries or at any specialized victim services, but instead experiencing domestic violence has several health effects that are both serious and long-lasting. Here is a list of the most common health problems associated with domestic violence. And as you can see, the list is extensive and it has many different problems, both physical and mental health problems. These have all been established in several studies. We also know that these health effects can last for a long time, even after abuse has ended, which makes them especially problematic. It is also known that the health effects are caused by all forms of domestic violence. Both physical, psychological, and sexual violence are very harmful. Actually, there are some indications, including my own research, that psychological abuse is most detrimental. And this is also something that should be remembered when talking about domestic violence and health. Okay, but despite all these health problems, we know that only a minority of the victims seek help. Most of them never tell anyone about violence. However, we do know that because of the health problems, victims of domestic violence use healthcare services more often than general population. The rates have been found to be even doubled. On the other hand, we also know that experiences of domestic violence are very common among several different patient groups. For example, among pregnant women and patients in emergency or psychiatric care, the lifetime prevalence of domestic violence has been found to be something between 20 and 50%. In Finland, data has shown that 3% of patients in birthing unit, 7% in emergency care, and 30% in psychiatric care have experienced recent domestic violence. These rates mean that every day hundreds and thousands of victims come to healthcare services. And this means that healthcare could be a very efficient place for identifying the victims and offering help to them. Because of this, it has also been recommended by the World Health Organization in 2016 that healthcare services should pay more attention to domestic violence. So next, I'm going to present some more data on why recognition of domestic violence in healthcare is important. First, we know that domestic violence often lasts long and it can get worse with time. And if not intervened, this cumulative violence increases the likelihood and severity of the health effects, making them more hurtful to the victims and more difficult to treat. This notion of violence getting more serious with time has also been supported by longitudinal studies that have found that the victims visit healthcare services with increasing frequency before their recognition. On the other hand, after the recognition, the visits decline with time, and this indicates that being identified is helpful to the victims. One such study was conducted by Heli and colleagues, and similar data has also emerged from my own research. So next I'm gonna show you some data from my dissertation. This data comes from victims of domestic violence who were identified in emergency care, and their medical records were analyzed 2 years before and 2 years after their identification. Here you can see that the average costs increased with time before the recognition and decreased afterwards. The red line presents average healthcare costs in the same region. And so you can see that victims of domestic violence, the black line, surpassed the average level of costs already 75 weeks or 1.5 years before being identified. During the 2 years after identification, the costs declined significantly, but they were still a little higher than the average level at the end of the 2-year follow-up period. So what does this mean? It means that recognition can be a turning point for the victims and help reduce both the healthcare visits and costs. It is noteworthy that these patients from this data set, they did not receive any special treatment. They were not identified as a part of our screening project, but instead during the regular day-to-day practices of the emergency care unit. And this should be good news to the healthcare professionals who are often busy and struggle with resources and who might wonder what good does it make to ask about domestic violence. And this data shows that actually it might make a very big difference in the long run. But still, the current situation with recognition is not very good in healthcare services, and there are some issues that should be taken into account. First, the identification rates for domestic violence are very low, meaning that most of the victims are not recognized. This makes it more likely for the violence to continue and the health effects to cumulate with time. There has been discussion on how to improve recognition. Others have advocated universal screening, aka asking all healthcare patients about domestic violence, whereas others have tried to find ways to identify risk markers for the high-risk patients. Some such markers have been identified. Many of them are similar to the health effects that I presented earlier. However, there has been contradictions between studies. For example, my own research demonstrated that it was very difficult to distinguish victims of domestic violence from other victims of interpersonal violence based on their healthcare records, because they all had very varying health problems. This indicates that it might be more useful to ask all patients, or at least all women, about domestic violence, because it is such a common problem among healthcare populations. A recent report from the UK also demonstrated that even if the victims of violence tell healthcare professionals about their abuse, this information is not always recorded or passed forward. This is, of course, a very serious problem and highlights the need for more training for the healthcare professionals, and also the need for more research on how to permanently improve the practices in healthcare, not just for a short time during a special project, but for a more permanent change to happen around the world in healthcare. Okay, so I'm almost done. I just want to remind you about my 2 key points. First, that domestic violence is a serious public health issue and it should be regarded as such. And secondly, that recognition of victims is helpful and it should be paid more attention to in healthcare services. Thank you very much for your attention. Here you can see my references that have more research on the topic, more things to read. Thank you.